How has InteleOne impacted your work?
We had a much larger volume of musculoskeletal MRI on our outreach system, and initially we didn't have Intelerad, and once we did switch over, I would say the musculoskeletal data became 20% lighter. Just not having to jump through the hoops back and forth through multiple PAC systems, and also just the speed integration was superior to the PACs they were using.
And how much time does InteleOne save you?
At least an hour or two a day.
And how exactly does InteleOne help you save this much time?
Before we switched over, I was reading from 3 systems every day, and so what was happening was I was constantly shifting back and forth, looking all around to find out, okay, is there an MRI on this one, or this one? Just bringing it into Intelerad made a huge difference in where I could just move on along through the studies as they came. So again, it would depend on the rotation and the subspecialty of the rad, but I would say the more subspecialized rotations like neuro, body, and MSK, it makes a substantial, again, I'm just gestalting at 20%, but that was my feeling, where it was difficult to leave without an hour, hour and a half later every day until we switched over.
What has been the clinical impact of InteleOne?
Huge clinical impact would be in that I don't miss priors that are in our system. The ones that are still on the outskirts from time to time get missed, but it's much less frequent because every time a study is brought up, it immediately looks for a similar patient, similar date of birth, and I get to choose based on criteria we set up, and they're almost, I'd say, though we set it at 70 or 80%, I can't recall, I'd say nearly 100% of the time I don't even have to worry. I know it's the same patient, but I still look at it and verify that from this other site that is not where the patient got the study done, it's the same patient. I'll find that old MRI or old CT, and then I can immediately link them up. So I would say the huge patient care and efficiency gains, they go hand in hand in that patients aren't getting re-imaged. You're able to compare what they had done before and see what we said and see what the reports were. You're going to get a better report if you had the prior and can put them side by side.
Have you seen an impact on turnaround time?
Again, off the top of my head, I don't know those numbers, but I know they're substantially improved because, again, it's more efficient. You're not having to look around. It's right there. We just kind of move through the cases. I mean, ultimately, our goal is to have all of our work on Intelerad. And many could argue the merits of one PACS or another, and those are good arguments and good discussions, and we could all sit around with which one you like better or the other. There's a bunch out there that are great, Eyesight, McKesson, what have you. But when you get past all that, the bigger issue is, as you go through, are you able to see or move through one work list without jumping around PACS systems? I think it's well worth it no matter where you stand on what your favorite PACS is. In the end, it has to do with workflow, staying with the same list, getting all the appropriate priors available to you instead of having to go, oh, there's a prior in this system, let me log into it and pull it up and find that patient.
And how do you like working with Televiewer?
Again, probably one of my favorites. You could argue the merits of others compared to it, but because of its ease of use and customization abilities, I think every rad has a different way of doing things. I found that it was one of those where I didn't feel the need to have to, for example, on other PAC systems I would have everything numbered or to a certain key number or whatever, but it was so easy to use I didn't bother. I right click and go. It would be more time for me to try to label everything to one keystroke or another. I'd just use the mouse and go forward. It was very user-friendly, I think more so than other PACs are.
Okay. How long did it take you to feel comfortable using Televiewer?
I'd say virtually instantaneous. I mean, it's just, again, it's easier for me. I'm pretty nimble with it, but I think for most rads would agree that compared to other systems that require more training, that this PACS is just kind of an immediate figure it out. It doesn't take a ton of training, in my opinion. And another thing I would mention day to day, even after work, is it's easy to use at home. Over the more cumbersome large PACS systems just don't work as well at home. Whereas Intelerad, I could comfortably read at home or bring things up without it crashing on me.
Okay, so
The reality is the PAX works better. It's faster, more responsive, it doesn't crash, integrates better with PowerScribe, again, faster with PowerScribe. So from day one, I really think there was an immediate improvement. And then as we got more comfortable with it, I think we're seeing it much more fluid for our group.
How long did it take for InteleOne's impact to be felt?
A couple days, a day. It was pretty dramatic.
Okay.
So yeah, I think ease of use is key. I think flexibility and again reliability. Anecdotally, I would say I can't speak to how many times there have been crashes or not, but even since we've gone live with a larger volume, I can't think of a time when Intelerad was down for any substantial period of time compared to the other packs, which down for hours.